All right, thanks everyone for joining today. For this webinar, we're going to be talking about 7 good reasons to switch to a cloud-based therapy EMR system and get off of paper or manual methods. My name is Dana. I have been with ClinicSource for almost 8 years. I am in Philadelphia. I'm in Philly. Here at ClinicSource, we're kind of all spread across the country. I'm in Philly, and just a fun fact about me: I'm a mother to an 8-year-old human and 6-year-old dog. My daughter's name is Demi, and my dog's name is Harrison. He's a poodle, and then we have another presenter here, Josh.
Hello, Dana. Yes, my name is Josh. I'm also an account executive over here at ClinicSource, and I've been with the company for a little over 4 years. I also reside on the East Coast. I'm in the great state of Virginia, and not only do I have a bulldog named Archibald, I am also a father, and I have an 8-year-old little girl named Riley.
For our agenda, we are covering what is a patchwork or paper system. So first, we're going to go over why you should ditch paper records, and this includes Microsoft Word or templates that you've created using Excel, actual paper, Dropbox, using a combo of a bunch of different systems. Then we're going to give you 7 reasons why the cloud is the place to be and why an all-in-one EMR system is beneficial. And then what about ClinicSource? We'll connect this back to ClinicSource and answer how ClinicSource fares in the competition for cloud-based EMRs and how it could be beneficial to you.
All right, but before we get into the reasons on why therapists should switch to an integrated cloud-based EMR system, I'd like to paint a picture on what many offices are still dealing with, and that is paper. So whether it's a little bit of paper, an intake form here, a SOAP note, a whole lot of things like photos and papers and maybe copies of IDs and insurance cards, that's not really making it a very efficient and compliant office. Now, practices that run entirely on paper these days are getting very rare, thankfully. But what I have seen are practices who are using an EMR or even a practice management solution, yet still rely on some paper documents in some form or fashion to run their practice. And when I say paper docs, I mean it doesn't necessarily have to be an actual piece of paper, but something maybe like a Microsoft Word doc, a Google doc, along those lines. And basically any sort of documentation, imaging, or notes or communication that has to be made or shared or saved in a system outside of their actual EMR. I refer to this type of system as patchwork. These practices have invented their own ways of creating and maneuvering documentation into light of shortcomings of whatever current system they're trying to use. While my hat goes off to them in their crafty ways, it does make this very hard. There's definitely a better way that doesn't require that type of work, which wouldn't be such a compliance risk. And of course, I'm talking about an integrated cloud-based system that essentially eliminates any need for paper. To most compliance officers, billers, front staff, the mention of going paperless, fully integrated office is music to their ears. But there's always that one person, usually not always, but the provider who thinks that they can't let their paper go. And I'm here to assure you that yes, you can.
Awesome. So what about me? So some of you may think, oh, well, I don't have physical paper files like this. I have digital templates that I created that I am using. When we're talking about paper, we're still talking about a number of different things, like all of these kind of piecemeal manual methods. So we're going to talk about a few different buckets of reasons why to ditch paper, including administrative staff burdens, provider struggles, and physical plan or physical location concerns. These still apply to a solo provider that does everything themselves. So if you just see that office with all of those paper records, still applies if you're a solo provider, if you're working out of a home office, mobile practitioner, traveling to different locations, to schools, homes. If you don't have a brick and mortar location, still applies because you still have to store those records.
Another good reason is basically going to be to staying up to date. What we have the ability to do here is a couple of different things. So the good reasons on why 7 reasons to ditch a cloud-based therapy or group by primary benefits. These benefits could be for the staff, they could be for the provider, or for the physical plant, meaning your physical office location.
Great. So reason 1 would be cleaner data. If you're using paper records, you likely have a system in place to track data, store documents, and process clients from start to finish. But regardless of how well organized you are, switching to an EMR will streamline data collection and decrease costly errors. There are so many types of therapy EMRs on the market, but all EMRs offer some level of data integration with other systems in your practice. Therapy EMRs are designed to interface with other systems that are critical to therapy practices, such as scheduling systems, documentation, billing, and more. Integration allows you to import and export data to maximize efficiency, eliminate redundant data entry, and reduce the risk of human error. Because you are not doing double entry of data in multiple systems, like adding manually in Word and then adding that information to Excel for billing to send to like a biller, or using that information to go to like an insurance portal to do your own billing or a clearinghouse, there's less opportunity for making mistakes due to human error. So therefore you have cleaner and more accurate data.
All right, and then the next one is going to be reducing kind of the burden on the admin side. And what I mean by that is one of the primary benefits of a therapy EMR system is the ease for your administrative workload. If you're one of those paper-based systems, you may be spending countless hours on administrative tasks such as appointment scheduling and call reminders. A therapy EMR system makes it easier to manage these tasks. You can enter in all your patient appointment details online. Changes are automatically transferred to all system functions that need that information, and every member of your practice will always have access to up-to-date minute data. Automating the appointment reminders will also save staff tons of hours and time from making phone calls, giving them more time to focus on more productive tasks like boosting the practice's bottom line. A therapy EMR lets you spend less time on paperwork and more time caring about your patients.
Great. So reason number 3 to ditch paper for a cloud-based EMR is easier documentation, and this kind of falls under the provider bucket. A therapy EMR can make it easier to document therapy sessions, and if you're using an EMR, you'll be able to view client data, notes, and more in real time. This allows you to enter information during the session, create progress notes, easily submit therapy bills, and more. A good therapy EMR will also simplify the charting process and integrate documentation with billing and reporting functions. For example, in ClinicSource, when you're adding your evaluation and your initial care plan, the information that you add, that flows into your note to make it easier. So when you're adding a diagnosis code initially for your patient, when you're adding goals in your plan of care, interventions that you outline in that all is flowing into your note to make that easier, saving you more time. Same thing with the schedule. When you are adding appointment information, that appointment information pulls into your note in ClinicSource, makes that a lot easier. All of this information flows over to billing as well to simplify that process. So no more plugging each treatment into, an Excel document one by one, or going to a clearinghouse or insurer portal and plugging in treatments manually. So makes that easier. All that information is flowing to that next step for you.
All right. Reason number 4, staying up to date. Electronic medical records are not just recording patient information, allergies, past medical history. Many EMRs are now coming up with compliance modules that can help your practice stay up to date with federal, state, and local regulations. Another important consideration when investing into a therapy EMR is whether your practice is planning to offer a telehealth solution. The COVID-19 pandemic has caused an explosion of telemedicine in nearly every medical specialty, including therapy. Modern EMRs include features to help facilitate those telehealth visits.
Reason number 5, performance tools. A cloud-based therapy EMR can provide advanced performance tools, including built-in patient tracking and robust analytics. These tools can help you better understand your patients and your business and make decisions on how to best use practice resources to attract more patients and retain the ones that you already have. So because you're adding all of your data within one system, you can use all of that data later to gain some more knowledge on your business. Whether you're a solo provider, an owner, or a director managing multiple therapists, this is valuable. In ClinicSource, for instance, we have features like CS Insights, a dashboard of data, including comparing therapists, productivity information, billing versus revenue over time, attendance reports, and more. We also have detailed reports on any other important areas. All reports offer filters to further target information like date ranges, provider, discipline, treatment codes, and more.
Now, moving on to our physical plan, reason number 6 is patient confidentiality and safeguarding those medical records. Whether you're a private practice or a part of a larger organization, your therapy EMR will help you protect patient confidentiality and keep those records secure. Your EMR will allow you to create unique logins and passwords for each one of your members of your teams. So not only are those information, but who actually is going to need access to it. Your EMR will also allow you to securely share patient information with other members of your team.
So finally, reason 7, data security. So since the advent of the Health Insurance Portability and Accountability Act, or HIPAA, standards for the security of patients' protected health information, or PCI, are strict, and financial penalties for breaches are staggering. A therapy EMR will help you meet HIPAA compliant standards by encrypting PHI and restricting access to it. A cloud-based EMR also provides secure backup for your patient data, because your data is stored off-site. If your office experiences a disaster such as a fire or a flood, your EMR can help you recover quickly with no loss of data or fear of a security breach. Even if you do not have a physical office, this can still happen at a home office as well. Everything in ClinicSource is HIPAA compliant and secure, keeping all of your PCI safe. ClinicSource is a cloud-based system, so you don't have to ever worry about losing your data. I actually recently spoke with a client who just moved forward with ClinicSource because data security was her biggest concern. All the therapists upload their notes to a secure file in a Microsoft Word template, but recently one of the therapists accidentally deleted a year's worth of documentation. So definitely was not good, but in a system like ClinicSource, it's not possible to do that, so you can avoid those situations. And if there was a disaster like a fire, a flood, you would be covered because our cloud servers are hosted in multiple locations across the country. You are even covered in the case of natural disasters. For example, with ClinicSource, we have servers in multiple locations across the country. So if we have a server in Florida, there was a hurricane in Florida, we still have a server in California. If something happened in California, like an earthquake, we still have servers in Colorado and so on. So your data is constantly being backed up for you, so you don't have to worry about it. With ClinicSource, every 2 minutes, we auto-save your work just in case you need that extra security.
ClinicSource actually hits all 7 of those checkboxes. And the first one starts with cleaner data. This all starts with our library of templates, including patient intake forms, HIPAA compliance, release of information, consent to treat, and more. These can all be completed by your patients digitally and automatically populated into the ClinicSource software. So no more manual or double entry, meaning a cleaner data from the start. Second, increasing staff productivity. ClinicSource integrates your EMR with practice management functions, scheduling, reporting, and even billing for that streamlined workflow that increases efficiency, productivity for all practice members. Easier documentation. Therapists develop treatment logs, simplifies and streamlines sessions recordings. Relevant diagnoses, CPT, G codes are pre-programmed for an easy selection, and automatic appointment or reporting reminders help keep all of these reportings on track. SOAP note software templates, goals populating from the care plan, the goal assist level type, the achievement percentage dropdowns make it easier for you to report on your daily progress. Progress note summaries and discharge summaries allow you to quickly track patients' progress, including the percentage of each goal was accomplished and to what degree. Automatic updates. This means that both compliant automatic updates as well as staying up to date with tools and features to deliver care. Our HIPAA compliant software is designed to help you stay compliant in ever-changing regulations. ClinicSource automatically updates as regulation changes occur, keeping your practice current without any additional costs for upgrades. ClinicSource can also help modernize your operations, including facilitating telehealth services with an additional of CT telecare to ClinicSource. You can practice easily and confidently, adding a virtual visit to any of the services from your practice. Performance tools. With ClinicSource, therapy practice management software, you can run reports not only for your clinical, but also the financial side of your practice. Easily track therapist productivity, authorizations, care plans, evaluations, changes, reimbursement, and much more. You can even run detailed reports on physician referrals, letting you know whom to thank and helping them maintain a healthy relationship. Patient confidentiality. User permissions customized mean that you can determine precisely who has access to which data. Setting up each user accordingly to their role in the practice gives you a complete fine-tuned control over access. ClinicSource automatically documents who can view that data and when, and tracks any modifications made. In the event of an audit, your comprehensive HIPAA compliant report is just clicks away. And then last but certainly not least is going to be data security. Because ClinicSource is a cloud-based, all of your data is stored securely offsite. We use one of the world's most secured server providers, and that's Azure Web Services.
Awesome. So the right choice for all types of therapy. When you're ready to make the transition to a therapy EMR, you couldn't make a better choice than ClinicSource, and here's why. ClinicSource is easy to learn and easy to use. ClinicSource Therapy EMR and Practice Management System is a cloud-based, all-in-one management solution that you can use anywhere from any device. The EMR is highly customizable to the way you practice, and our system is intuitive and easy to learn. We make transitioning as easy as possible, and our implementation experts will guide you through every step of the way. Many systems out there actually do not offer any training at all, but with ClinicSource, we give you in-depth one-on-one training sessions covering each individual topic like setup, documentation and scheduling, billing, learning how to customize templates, and more. You also have a ton of resources like a video library and user guide as well. ClinicSource is also completely integrated. ClinicSource integrates your EMR with your practice management functions, scheduling, reporting, billing for a streamlined workflow that increases efficiency and productivity for every side of the business. ClinicSource gives you access to therapy-specific features. ClinicSource was designed to meet the needs of therapists of all specialties. We've been around for 18 years. We support speech therapy, occupational therapy, physical therapy, mental health, and ABA. And all of those templates and needed documentation for these therapies are included when you get started. Evaluation, templates, tests, assessments, note template, diagnosis codes, goals, progress report, patient forms, and more. We also are highly customizable, so you can actually even build your own disciplines and make your own templates for other types of therapy as well. Our template library is organized by discipline to make it easy. ClinicSource is created and backed by experts. ClinicSource is used and trusted by thousands of professionals every day, including large and small businesses, single and multi-location practices alike. ClinicSource has been offering the best in therapy for EMR for decades. It was created for therapists, by therapists, and supporting our users is important to us. We are continuously striving for improvement and have added new features based off of our customers' requests and needs, and have attended hundreds of industry events since our inception. A ClinicSource subscription includes software support and automatic updates. We will also help you migrate over your existing patient data at no additional charge. And we're confident that when you see the difference ClinicSource can make to the way you practice, you'll be ready to make the transition from paper to electronic health records.
All right, well, that is going to be the presentation for today. Thank you very much for your time. Now, when it comes to next steps, get in contact with either myself or Dana. And our emails are on the screen, so you have the ability to reach out to either one of us, and we'll be more than happy to help.
Yeah, the live demo is really helpful. So if you're interested in learning more, we can show you how the software works and show you the specific templates for your type of therapy and cover any features for your individual needs. So you can, again, reach out by email. Thank you so much for your time. Thanks, Josh, and have a good one, everyone.